Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAX. Thank you for joining me in another video using the WAXscope. And here we have a patient with bilateral fully occluding, quite wet and loose earwax. They've been using some olive oil softening drops for a week. Typically when I see patients, I prefer them not to use drops just because excessive drops can make the wax almost molten and liquid, and it's just a bit more difficult to remove the wax, if truth be told. But so we're just commencing with this their left ear. As you can see, they've got quite a bendy, twisty ear canal, and I'm using our medium-sized specular, and I was unsure whether I would be able to insert that, but you can see I've just managed to squeeze it in and dilate the ear wide open. So this wax has been there for a while. We know that by the colour, it's oxidized. So freshly secreted wax is more of a pale orange, light brown. This has got quite dark, so it's almost dark brown, almost pitch black actually, a bit more medially as we approach the eardrum. So we're just removing this in layers. They have got quite a lot of keratin as well, that's enveloped the wax plug, and it's also still semi-adhered to the canal wall. So this wax here is probably in the last third of the ear canal. It may not appear that it is, it's just because of the magnification. And what I'm trying to do is just separate it from the posterior canal wall. You can see that movement I was deploying with the suction probe. I was leveraging it away to detach it. You can just see a hint of the eardrum about 1 o'clock in the distance, that blue tinge. And we just want to now slowly just get a suction grip and then tease this away because it is attached to the eardrum. You've got to be careful when you position the suction probe. If you apply too much pressure, you're actually pushing the wax plug up against the eardrum. So you just almost want to hover over it and then slowly tease it away. So this wax is a lot darker than the more lateral wax. And because it's quite a wet consistency, some of it is getting suctioned up the suction tube there. So we're using a 14 gauge suction probe. In the UK, we generally make reference to a 14 gauge suction tip as a Zollner suction tip. But if you're using the Birmingham gauge system, you apply numbers. So the lower the number, the larger the internal diameter of the suction probe. So what is normally known as a Zollner, we can classify that as a 14 gauge suction tip. And if you're using a fine end, that's an 18 gauge suction tip. So we're slowly but surely bringing it to the entrance. Again, I've got to just stretch this ear wide open. And when you're using the WAXscope, you have to utilize that slit at the top. The only downside is sometimes you can get a few hairs that enter, but the more experience you come with the WAXscope, you can mitigate that as well. You can learn to push them to the side. And even if there's a few hairs there, as soon as you insert the instrument, so in this case a suction tip, it pushes the hairs out of the way. So we've cleaned the ear. There's just a bit at the roof of the ear canal, so I'm just going to remove that. So again, I'm going to dilate the ear canal entrance. You can just see how wet this wax is. Now I'm using the fine end. So in fact, I use a 17 gauge suction tip as opposed to the 18, so it's slightly bigger than the 18, but I think it's less blockages and it's still very narrow. You just get a bit more suction. There we are. So you can see the ear's quite wet. We're not going to try and mop everything up. There's a bit at the entrance that I will, but a bit of wax is good for us guys, especially with this type of wax because it's so wet. It's impossible to remove everything. You're just going to be causing trauma to the canal wall. So we just want to clear the occlusion which we have. So again, going to dilate the ear open. Got a brilliant view of the eardrum there. So I'm just going to adjust the focus a little bit. You can see all the blood capillaries supplying the blood to the hammer bone, also known as the malleus bone. So instantly the patient could hear a lot better. So I'm just moving on to the right ear. So this is, I would say, I've made a grading system of wax. I would say this is a grade 3. So it's not fully blocked. That would be a grade 4. There was a bit of an opening anteriorly and posteriorly, as you can see a bit of the eardrums, just see it away in the distance. So this is not as dark. This is a bit more of a typical colour of earwax. That's, notice it's not freshly secreted, it's not just materialised recently, but the left side was quite an extreme blockage. So just going to move that large chunk there. I did take a still image, but I don't know where it is. It doesn't save on my phone, unfortunately, otherwise I would have shown you guys. Just getting the eardrum in focus. So if you are an earwax removal specialist and you're interested in upgrading your current visualization system, or you're suitably qualified and you want to be trained to perform earwax removal and you're interested in the WAXscope, please do email info@clearwax.co.uk. Take care. Bye.